today I'll really quickly follow up on some of the presentations from Usana and what Vicente have already said about what are the opportunity that the iRaise program offer to really go further into the adoption of innovation in your facility. So at the start of the project, what we've seen is that when we're working on this, and already last year, is that less than 25% of public funding for research and development results in products reaching the market because they're not driven by the consumer, thus they're not really aimed to meet concrete needs. And of course, over 50% of public procurement initiatives do not actually reach their expected goals because procurers often are not informed enough about the different solutions, pros and cons. And I feel like Rosanna covered just a little bit of that earlier as well. And finally, public innovation procurement represents less than 17% of the total public procurement in all EU countries. So in addition to that, there's of course a need for knowledge and skills for health professionals to be able to properly define their unmet needs, which is related to the lack of knowledge, of course, about the solutions and the full innovation process and supply chain. And the successful adoption of innovation requires a receptive environment. And I feel like iRaise, we feel like iRaise provides the tools to face the barriers to change and adoption within health organizations. So in addition to the content of the program, which we receive a little bit of a snippet of, one of the most valuable features is the iRaise community. And this community includes the program lecturers and the iRaise mentors. And right now, this slide is showing you some of our lecturers. So they'll support you in accessing the key elements for the adoption of innovation in your organization. And it's quite a multidisciplinary team of experts, and they're in the fields of value-based procurement, such as Usana, health economics, quality assessment, innovation development, adoption, and management, as well as strategic leadership. And of course, those lecturers, they're academics, researchers, practitioners, and they all have many years of experience in leading the digitalization and digital transformation of health systems. So some facts about last year. This year is the second year of iRaise, and last year the project was called uPraise. And there have been 23 trend mentors across Europe that will support your challenges and promote innovation adoption in your healthcare facilities. And those mentors are, of course, part of the consortium and previous let's say, alumni of the project. And in 2020, last year, 8 hospitals teams from Spain, UK, and Italy actually learned how to solve their specific unmet needs with iRaise. So those, as I said, those alumni are also active part of the iRaise community that you will have access to. And some of their testimonies about the program. For example, we have Ruth Solana Garcia, who told us that the program helped them in designing a project from the ground up and to develop a business plan. And they have actually used that to participate in the digitalization of their institution by building their hospital strategy plan. So this went a little bit beyond just their specific unmet needs. Then we also have another example from Kirsten Pilar Miller that we also call Kiki. And for her, it was really nice to be able to learn about the challenges that the organization is facing and the way they have found to address those issues. So if you were also at our last webinar, it was a lot of what is unmet needs, for example, and sometimes what you perceive as an unmet need might not necessarily what your unmet need is. So how do you figure that out? So those are some examples of the impact that the tools that iRaise have provided some of our alumni, and how they've taken those tools to not only implement that in their specific project that they worked on during the program, but beyond at an organizational level, and some of them at the systems level in their national country. So there are some couple of dates to remember. So our applications are open until the 16th of July. However, if you do have some questions or you would like to speak to us more about that, please feel free to contact us and we can discuss some of those things and about getting your application on time. Training starts on 20th of September and ends on 26th of November. So registration is currently open and on the website. And of course, we will be contacting you following this. There will be more information about the program timeline and everything. So there will be 9 weeks of online, live and recorded lectures, mentoring sessions, networking with industry partners, and of course, pitching activities.
So also we have here the Twitter account, the LinkedIn, and the website, where in the website you can see the guide for applicants and the flyer and the program, the list of lectures. So I can give you a broader overview, but that was just to give you a snapshot and just to show you about the power that's behind this course. That's again is focused on innovation adoption, because after discussion with a lot of industry and also healthcare organization, that's key. Because a lot of funds are coming now from Next Generation Europe and other places, and we need to be ready, and that's something that we need to make disseminate, and that's something key.